Okay, welcome and aloha. We want to thank all of you for being here today, for joining us with our Facebook Live. I'm very excited about our Facebook Live event today, and we have a special guest. So I'll be introducing her and sharing more about her biography with you a little bit later. But we have Dr. Carmen Shaison, and she's joining us today. She's a psychologist who has expertise in our topic today. And so, to take you back a little bit, in June of this year, we introduced some new cutting edge technology to our community. It's called Neuroptimal, and it works directly with brainwave patterns. And it actually helps to train the brain effortlessly while one listens to music or watches a movie. I've now had patients with autism, ADHD, depression, anxiety, and other conditions who have used or are using the device, and each one of them has seen improvements, and we've seen some really impressive results in some of our patients. And so today's event is going to give you more knowledge about Neuroptimal from a psychologist who uses it in her practice. So again, we want to thank you for joining us today. I'm Dr. Catherine Taketa-Wong. I'm a naturopathic physician and ND. And like medical doctors, I attended a 4-year medical school. I was trained as a primary care physician. I order lab tests, write prescriptions, and do school physicals, the same as any other doctor. But with naturopathic medicine, there is much more. The typical medical school offers about 19.6 hours of training in nutrition, while naturopathic doctors receive about 155 hours of training in nutrition. And it's really about building health from the inside through the power of nutrition. Applying that knowledge to a patient's condition takes a lot more time than just prescribing pills. So my office visits are a full hour. In addition to that, I'm also a licensed acupuncturist trained in Chinese medicine. My goal was to educate myself as widely as possible because my passion is to help people not only to get healthy but to stay healthy. And I know that that is also a passion for Dr. Shaison as well. And I love caring for my patients and believe very strongly in working with them as partners in their health and well-being. So in just a moment, I'll be formally introducing Dr. Carmen Shaison, who completed her postdoctoral training in neuropsychology. And she has extensive experience in psychological assessment, including the diagnosis of learning disabilities. Now, if you are interested in what Neuroptimal can do for you, or if you have a health condition that you would like to talk with me about, please call our office and schedule a free phone consultation. There is no charge because I don't take new patients without reviewing their situation first. We discuss your health concerns and come up with a plan that would help you the most. So to schedule a free consultation, just call or text our office or click on the link in the post. All of our contact information is on our Facebook page, and you don't need to be a patient to sign up for Neuroptimal sessions. We'll also be putting a link for Dr. Chaison's information so that if you want to contact her, talk with her about all the things that she offers, then you'll be able to get access to her and for her contact information, website, and everything that we will be including in the post after this presentation. So to formally introduce Dr. Carmen Shaison, she is a licensed clinical psychologist practicing in Hawaii. She completed her pre-doctoral internship at Kapiolani Medical Center in 1995. She was a professor at the University of Guam for 2 years and completed a postdoctoral internship in neuropsychology in 1999. She previously worked at Kahimohala as a psychologist for a child and adolescent inpatient treatment. Dr. Shaison treats clients of all ages and most diagnoses. She previously had a 7-year contract with 0 to 3 where she conducted intake assessments, treatment planning, and individual play therapy and family therapy for clients aged 0 to 3. Dr. Shaison has worked extensively with clients of all ages with autism spectrum disorders and attention deficit hyperactivity disorders. She has worked extensively in the assessment and treatment of children and adolescents with learning disabilities and academic decline, providing recommendations for 504 and IEP programs. Dr. Shaison also has experience in the assessment and treatment of depression and anxiety disorders for all ages. Dr. Shaison is also able to conduct geriatric assessments for mental status and provide individual and family therapy for geriatric clients. Most recently, Dr. Shaison began a neurofeedback clinic using Neuroptimal. She provides in-office Neuroptimal brain training sessions as well as monthly rentals for the Neuroptimal machines. She's very excited to be expanding her neurofeedback clinic to include both the Honolulu and Kailua areas in the new year. Dr. Shaison's hobbies are bodyboarding and songwriting. She is also writing a children's book about the menehune and a book about finding your best path in life. Both are scheduled for release in 2022. So again, please welcome Dr. Shaison. Thank you so much for being here. So that was, you have a pretty extensive background. And so I'm just curious to ask you about your background and how you got into this field initially.
So I was fortunate enough to, do you mean psychology or do you mean Neuroptimal?
Well, both actually.
Well, for psychology, it was something that I always had an interest in because I had a first cousin with Down syndrome. So as I grew up next to her, I kept advancing, but she didn't. So I always wanted to help children and people, families that went through that as well. So coming to Hawaii, I was very fortunate to have that internship with Kapiolani Medical Center at their counseling center for women and children, and just a fantastic place to have an education. I fell in love with Hawaii. I got my PhD from the University of New Mexico in Albuquerque. So I was really happy to return to Hawaii after I graduated and after teaching in Guam for 2 years.
Nice.
And yeah, so as far as Neuroptimal, I'm very excited about it as a neuropsychologist. It's just really amazing what it can do. It's like basically a tune-up for the brain. And it tries to bring your brain back to its prior optimal functioning before life happened and interrupted it and developed negative patterns.
Yeah.
So interrupting those negative patterns is basically what happens during a session. And after sometimes one session, sometimes 10 sessions, sometimes 20 sessions, you can have a shift where that negative repetitive pattern just fades away.
Yeah, and I've definitely seen that in my practice as well. So just to kind of expand on that, in terms of Neuroptimal, for our viewers, if you could talk a little bit about Neuroptimal itself, like what it looks like, and then explain a little bit more about how it's working.
Okay, so what is happening is it's called Dynamical Neurofeedback, which is a huge change from the previous type of neurofeedback, which was linear. So with Dynamical, the Neuroptimal program, you actually are attaching just 2 sensors on each side of the head, halfway between the top of the ear and the top of the head. And that reads a summary of the activity of the brain. And then what happens is that information it goes into a computer. It converts from analog to digital through an amp. And when it goes into the computer, it goes into the Neuroptimal program. The program, they've spent 40 years working on this program. It's new science to us, but this is science that is very hard earned and it's improving all the time. So right now, okay, so all this information is going into the program. This is really exciting. And the program, the information was converted from analog to digital so that it could go into the program and the program would understand it. And then the program detects patterns in the brain, and the feedback is given only auditorially. So it's only given through headphones or through speakers. And when you get that feedback, there's no electricity being put into the brain. So this is a huge difference between linear and dynamical neurofeedback. So this is, as far as I know, the only program that does this dynamical method, where you're only getting feedback in an auditory form. What's super interesting is that the program speaks the language of the brain, and the information is given to you 256 times a second. So basically, the Neuroptimal program is speaking the language of the central nervous system, and that information is detected mostly subconsciously. So you don't hear 256 times a second. What you do hear is when there's a bigger pattern detected, you'll hear a shift in the music. There'll be like a scratchy sound in the music, or a slight delay or pause in the music. And that means the information was read, they detected a pattern, and the brain is being told, oh, I noticed a pattern. Noticing the pattern allows the brain to change.
And
it's like the simplicity and beauty of it, and the fact that it is 100% safe because there's no electricity being put into the brain. That's what's really phenomenal about the system. And it seems like the linear method is more an educated guess. Oh, that gave you a headache? Okay, we're going to move it over here. Versus, I haven't had any negative side effects from the patients I've had that have tried the Neuroptimal. About a third of my clients have tried it, and some have decided to rent the machine, and also it's available for purchase if someone wants a home model that they can use for themselves and their family.
yeah. And the analogy that I give to my patients when I'm explaining it to them is I tell them that it's kind of like allowing your brain to look in the mirror, you know? And I tell people, like, for example, if you were wearing a hat and the hat's crooked, you may not be able to tell just from the way that the hat feels on your head. You may not be able to tell that the hat is crooked, but then if you look in the mirror, then you can see, oh, the hat's crooked, and then you can correct it and adjust it and straighten it out, right? And I tell people that sometimes it's like our brain is, just not totally balanced. It's like it might be just a little bit crooked or a little bit off, but our body knows how to heal itself. And I think that that's something that both you and I believe very deeply in, is that our body does have the ability to heal itself. And this is really almost like giving your body that chance, in a way, your brain, because it's like, the feedback is like allowing their brain to kind of look in the mirror and to see itself and to see, oh, this is the kind of brain pattern that I have, and to realize, oh, it's actually like not totally balanced. So here, let's just correct it. And that your brain is actually the one that's setting the target and trying to help correct itself, rebalance itself, and to heal, to literally help assist your body in healing your brain, helping your brain to be able to heal itself. And that's what I love about it. I think it's just amazing.
I think it is as well. Like, one thing I noticed, because I do Neuroptimal about 5 days a week for myself, and it's something, it takes about half an hour, and I can do that while I'm finishing paperwork at the end of the day. So it doesn't even take any of my time. But I noticed that my visual memory got a lot better. It wasn't very good before. I would play memory games with the kids because I knew they would feel good because they would beat me. But after I did the Neuroptimal for about a month, I started beating them, and then I felt bad. It's like, I know where all those cards are now. I was really surprised.
Yeah.
That, and I can park in one parking spot now instead of two.
Nice. Yeah, it's pretty amazing. And I mean, I know that we can't share like specific, patient information, of course, but I'm just curious about some of the things that you've seen in your practice, just with some of the comments that, patients have noted or parents have said about what they've observed in the course of using Neuroptimal. So.
Well, everyone that's tried it has really felt a pretty big improvement, both with them, like with adults and with children. And one thing that was noticed was that um, kids with autism, the parents were saying that they noticed that they're more mature. And that's definitely something that is beneficial, because that's what we're trying to do, is help these kids approach their actual age from their mental and social age.
Mm-hmm. Mm-hmm.
And so that was one thing. Another was that they're more articulate and more verbal, which is huge with autism as well.
Mm-hmm.
With ADHD, I've noticed quite a large changes in focus and less aggressiveness with kids that have a tendency to become aggressive when they're, when they get to a point where they're not stable. I've also used it with people, and there's research conducted by Neuroptimal on this with chemo brain, and I had huge improvement with reducing brain fog and basically getting their life back. I had a patient that would get lost driving, and then after Neuroptimal, he always knew his way and didn't get lost driving. It was pretty significant. And a patient with long COVID actually started getting their sense of taste and smell back.
Oh,
Which
wow.
is, there's actually no treatment for that.
Right.
So that's huge. And the brain fog lifted where they could do their job again.
Wow, that's amazing. Yeah, because I'm
Yeah.
treating right now some patients with long haul COVID, and so, you know, um, yeah, so that's great. I mean, uh,
And,
yeah, and what have you, I'm curious about what you've seen with patients with things like anxiety or depression.
I find that it's working more to help clients with anxiety than depression. I mean, if someone has both, it's definitely helping the anxious part more.
Mm-hmm. Yeah.
Yeah, I haven't seen as big change with people with depression, but maybe it would take more, a longer course of treatment.
Mm-hmm.
Yeah.
Yeah. Yeah,
But
because,
Neuroptimal basically gives you a benefit from where you're at, and it optimizes your brain. So I don't know if you had a different experience from that between depression and anxiety.
yeah, I mean, I've used it to treat anxiety. I would say on depression. Yeah, I haven't used it too much with depression, and most of the patients that I'm using have both anxiety and depression. Yeah, and I would say the same thing, that I've seen improvements in the anxiety, and there's patients who have both, where I think they're just kind of feeling better overall, and so their
Yes.
depression seems a little bit less, but they're also less anxious, and so it could be just a combination of that. Um, yeah, and I have some kind of neat stories too in terms of some of the things I've seen with patients. Like there was one young man with autism where he would stim a lot, and for the viewers who aren't familiar with autism or what stimming is kind of a reference to stereotypical repetitive behaviors. Like some kids are like going like this, or they might be flapping their hands or spinning around in circles or jumping up and down repetitively for long periods of time and things like that. And it would kind of interfere with his ability sometimes to be able to function or do his homework or other things. And his parents had to keep reminding him, okay, don't, we need to do our homework now, so let's, stop focusing on, let's like focus on this instead of stimming. Um, and then they found that his stimming actually stopped after the first session. He didn't stim for the whole rest of the day, and then after that, they found that his stimming, um, like went away.
Wow, that's
You know,
amazing.
yeah. And I had another family where um, the young adult with autism, and then he had never really taken an interest in books, but then he started reading books and started reading it to his younger sibling, which they were pretty amazed at. They're like, "Wow, he's never done that before." And another, um, I have another case where there was a child with autism that had taken an interest in years past with, had basically taught himself some second languages, and hadn't really been interested, kind of lost interest in it, and then for a few years, and then after doing Neuroptimal started taking an interest in it again, um, and started doing that. And I also have a patient with Parkinson's that's a very interesting case. And I told him, I said, I don't know if this is going to help you or not. I'm not sure. There's not clear research yet. There's definitely research suggesting that neurofeedback may be helpful in Parkinson's, but I don't know. It's not like proven by research, but he wanted to try it. And so he has a resting tremor, meaning that whenever his hand is not moving, then it's shaking. And then he said during like his very first Neuroptimal session, he was using the machine, and then as soon as we started the Neuroptimal session, his hand stopped shaking, and it stopped shaking for the entire time. And then as soon as we turned it off and finished the session, then the tremor started again. And
Oh, wow.
he's now been doing it for a number of sessions, and it's really interesting because and he's early stage, so he's not taking any medications yet at this point for Parkinson's, and there was no change, in any of what his routine was, in terms of before starting Neuroptimal or during Neuroptimal. But he now said that he has some times where he notices that he will go for, because before his tremor was really constant, and it was just happening all the time. And then now he's noticing that he'll go for periods of time, like a half hour or maybe an hour, where he doesn't have the tremor now. And so he's really excited and really encouraged by that. And so that's some of the pretty cool things that I'm seeing. I'm like, wow. I mean, even I didn't expect that. I was surprised at that. So I was like, wow, that's really exciting. And there are also some case studies with children with seizures where it's been helpful. So I haven't used that too much yet with seizures, but I'm going to start using it. I read that case study recently, so I was like, oh, okay, this is pretty interesting. So I was going to start recommending it for patients with seizures, because as you well know, having worked with many children with autism, like seizures are quite common among children with autism. And even children without autism, of course, can have seizures and epilepsy. So yeah, so that's something that's pretty exciting too. That's like, wow. So yeah, any other things that you wanted to share in terms of observations or things that you've seen with patients?
Oh, I know that they're actually doing a study on long COVID right now, long haul COVID, at Neuroptimal.
Yeah,
So
that's really
if
exciting.
if I get that, when that's finalized, I'll give it to you.
Yeah, that's really exciting. And definitely
Yeah.
because, I mean, there's not really very many treatments. I mean, there are some treatments, I guess, medically, that I am using for some patients with long haul COVID. And it seems to be that the immune system could be an issue, or that chronic inflammation, it could be a contributing factor. So, so I am working with patients with those kind of things, but I hadn't even thought about Neuroptimal actually. So that's really exciting to think about. It's like, oh yeah, that could be, that could be helpful. So, um,
Yeah, I was, getting her sense of taste and smell back. that was pretty huge because she's the one
Yeah.
that cooks in the family. And I mean, you don't know what it's going to taste like.
Right. Yeah. Yeah. Oh, definitely. So, yeah,
Yeah.
that's great.
Just improving quality of life. Yeah.
Mm-hmm. Yeah. Yeah. So,
And I'm hoping that it may have a benefit for any type of brain fog, like with
mm-hmm.
other disorders um,
Mm-hmm.
that uh, that cause a lot of brain fog.
Yeah.
Yeah.
There are definitely a lot of disorders that can cause brain fog. So, I see a lot of patients with low thyroid function, low adrenal function. There can be nutrient deficiencies or other kinds of things. And sometimes
Mhm.
people just don't have a diagnosis. They're just like, I feel like I can't think clearly. It's just like my
Mhm.
brain's just not, it's
Yeah.
not working right. So, yeah.
Fibromyalgia as well.
Mm-hmm. Yeah. Yeah. Lyme, chronic Lyme disease. Yeah.
Right.
Yeah. I definitely have a
Yeah,
member of
that's
chronic Lyme
pretty
disease.
debilitating
Right. Mm-hmm.
neurological effect.
Right.
Yeah.
Yeah. Yes. I have a number of chronic Lyme disease patients as well, where, that's definitely a concern. So, yeah. Well, okay. Again, that's so great to hear. So, I just wanted to really thank you, again, Dr. Shaison, for being here with us. And I think what's important to keep in mind while we're discussing Neuroptimal is that how it can help with various symptoms of conditions like anxiety or insomnia, ADHD, autism. And I think what's important to remember is that, working with patients, that my patients and I are really in a partnership for health. And so it's, my protocols and guidance added to their commitment to improving their life really enables them to be empowered when it comes to their health. And that means that they learn how to heal their condition or their child's condition, which just brings more health and happiness for the whole family. And if you're viewing this and want to talk with me or Dr. Shaison about Neuroptimal, or if you would like to talk with either of us about a specific medical condition, then you can feel free to contact us. Again, for me, you can call or text our office to schedule a free phone consultation with me. There's no charge for me because I don't take patients or Neuroptimal clients without talking to them first. And I always want to make sure that what I do fits their needs. You'll find all the contact information on our Facebook page, and you can also click on the link in the post. As I mentioned, we will also have Dr. Chaison's website and her information here after the presentation is concluded. So you can definitely contact her there. And Dr. Chaison, I really want to thank you. I just appreciate your taking time to do this event. And for our viewers, I trust our discussion about Neuroptimal has been helpful for you. So you're welcome to talk with either of us, and you can talk with me with a free phone consultation. And it's really about being empowered with your health. So again, all the contact information is on our Facebook page, and we will have another Facebook Live back here in another 2 weeks. Again, thank you for being here, and
Thank
aloha.
you for the opportunity.
Yeah, thank you, Dr. Chasson.